You're welcome to yet another episode of Easy Access to Healthcare for All, a program sponsored by the National Health Insurance Authority, NHIA, to keep you abreast of its strides as it moves Nigeria towards attaining universal health coverage. My name is Aisha Muhammad Ahmed, your regular anchor. Towards ensuring the fulfillment of its mandate, the NHIA introduced the NHIA Medicine Supply Initiative, which targets three core areas, namely branding of drugs, cost sharing, as well as innovative financing. These initiatives would provide medicine security for enrollees when they visit the facility and cut down on the out-of-stock syndrome bedeviling the health insurance system. Our program this week focuses on the cost-sharing component of the NHIA Medicine Supply Initiative, which is a move to subsidize cancer medications and antibiotics for NHIA enrollees. These, alongside other segments of the program, will complete our package this evening. See you after the short break for details.
Let me see your bill. What is this in your bill?
Oh, it's gift ship fully paid. Are you an enrollee? Are you registered under the Group Individual Family Social Health Insurance Program? Gift ship.
Gift ship. What is gift ship? Tell me about it.
GiftShip is a group individual and family social health insurance program. Now, the health insurance is mandatory for every Nigerian. GiftShip allows artisans, traders, farmers, mechanics, business owners, taxi drivers, even keke riders benefit from a range of medical surgeries, medical tests, scans at any preferred NHIA accredited hospital in Nigeria. To enroll, an individual contributes only 45,000 naira per annum. For a family of 3, 45,000 naira per annum. Group of 10 persons and above, 15,000 naira a person per annum. This amount is renewable every year.
We begin with a highlight of events around the NHIA. In the news, NHIA trains staff on basic healthcare provision fund implementation tools, just as it collaborates with the Nigerian Health Watch to hold a health financing dialogue. Keep watching.
Whether you are under health insurance,
The National Health Insurance Authority recently organized a 2-day workshop on domestication of basic healthcare provision fund oversight tool. The participants were NHIA state coordinators and NHIA program officers. The objective was to train the state coordinators and program officers on the monitoring and evaluation tools in order to provide supportive supervision and monitoring towards achieving the goals of the fund. The workshop was also to build a strategy that will improve the quality of basic healthcare provision from the facility level to NHIA database. In addition, enhance the full understanding of implementation and reporting protocol by the state social health insurance agencies, local government monitoring and evaluation officers, and healthcare facilities. Speaking at the event, Dr. Sikiru Salauddin said the meeting is to educate state coordinators and program officers to help boost their performance on the BHCPF.
This training become very important as a fallout of the last peer review meeting with the state coordinators that was held early this year. At that meeting, the Director General, Professor Mohammed Nasir Sambo, expressed his displeasure on the implementation of basic care provision form at the state level. And he attributed to the very low performance with regard to the implementation on the very low capacity and capability of our state office to monitor the implementation. So that's called for this workshop.
The workshop was loaded with various sessions that will educate and empower coordinators and program officers when they return to the field. At the end, participants shared their thoughts on the workshop.
For the first session that we have done today, Obviously, we've been informed on a lot of things that have been going on. There is a bit of a communication gap, which we are realizing now that trainings like this are needed at most times, so that the state coordinators will have on-the-spot information on what is happening with their state health insurance agencies. So it's a welcome development, really.
Now, with this training, we have been able to know the roles are properly defined, the state social health insurance agencies, and our role as the Kwara State Health Insurance Authority Office. Yes, we have learned a lot. That is the demarcations about the data collection and how they are collected, and the uses and the role of the state offices in collecting the data.
Checking that,
The National Health Insurance Authority, NHIA, in collaboration with National Health Watch, has organized a health financing dialogue with the theme Accelerating the Implementation of the NHIA Act to Improve Health Insurance Coverage in Nigeria. The event assembled various stakeholders across the health sector, civil societies, traditional rulers, and market women associations.
is very apt.
Delivering his keynote speech, the Director General, National Health Insurance Authority (NHIA), Professor Nasir Mohammed Sambo, said the dialogue is timely, having in mind the role health insurance plays in the attainment of universal health coverage.
You will all agree with me that there is a strong relationship and link between health, productivity, and socio-economic development. Health insurance especially operates within this context of socio-economic development. The higher the gross domestic product (GDP) of a country, the greater the macroeconomic stability and the more likelihood that the adequate funds will be available to effectively run health insurance system. On the contrary, the higher level of macroeconomic instability due to rising inflation without commensurate inflow into the national health insurance ecosystem, the more likely that the explicit benefit package will continue to dwindle both in terms of quantity and quality.
Speaking at the event, Vivian Ihekweazu, Managing Director, Nigerian Health Watch, said a successful implementation of health insurance is key for the attainment of universal health coverage. She added that operationalization of the new NHIA Act will reduce out-of-pocket expenditure.
We are here today to talk about how can we ensure that health insurance is made accessible and available to all Nigerians. Because we are all aware that the successful implementation of health insurance will be key in achieving UHC and improving the health outcomes of citizens. However, unfortunately, to date, UHC has not, health insurance has not been implemented as optimally as it should. But to achieve UHC will require innovative funding mechanisms, and these are some of the things we're going to be discussing today. And will ensure that everybody, low-income, vulnerable groups, have access to healthcare without suffering any financial hardship, which really are the tenets of universal health coverage, to ensure people have affordable, accessible healthcare without facing any financial hardship.
The Health Financing Dialogue touched on issues like understanding the roles and responsibilities of different stakeholders in the implementation of the NHIA Act, as well as exploring innovative financing mechanisms for the Vulnerable Group Fund and many other topics.
Welcome back. The program is Easy Access to Healthcare for All, a program that brings you highlights of news and happenings around the National Health Insurance Authority. The cost-sharing initiative is a collaboration between Roche and NHIA, as well as Pfizer and NHIA. It provides enrollees with affordable cost on intensive drugs, as well as cancer medications. Let's get details of how far this initiative has come, its implementation, and the successes recorded. Stay tuned.
As part of the NHIA's effort to fulfill its mandate of achieving universal health coverage, the authority started the NHIA Medicine Supply Initiative, an initiative that targets 3 core areas, which include branding of drugs, cost sharing, as well as innovative financing.
This initiative is designed to address the lingering problem of out of stock, as well as incessant complaints of substandard drugs by the enrollees. Under this arrangement, drug manufacturers will manufacture NHI's branded drugs at a cheaper rate, therefore addressing the issues of availability, accessibility, affordability, and quality drugs for our team enrollees.
The cost-sharing component of this initiative has direct impact on enrollees when they visit the facilities. How does this relate to health insurance in general?
The cost-sharing looks at expensive drugs that are cost-intensive and ordinarily difficult to afford. And so we use innovation by discussing with the pharma companies to look at making it affordable for the health insurance industry and also for our enrollees. So where there are co-insurance or co-payment for those drugs, with this innovation, it becomes bearable, let me use that word, for our enrollees, because at that point, the pharma companies would have taken so much of the cost off both the system, the health insurance system, and the enrollees.
To implement this cost sharing, NHIA signed a memorandum of understanding with Roche and Pfizer to help provide antibiotics and cancer medication to enrollees at affordable cost.
The essence of the MOU is to partner with the NHIS. On the first thing is to bring qualitative medications through a reimbursement model to make it available for cancer patients in Nigeria. And they are top-notch medications that are used all over the world, biologic medications, to make it accessible to Nigerian patients who have enrolled with the NHI. Primarily for cancer treatment, they are first-class biologic medications that are used in the UK, the US, and we have to make it available for Nigerians.
What we have done today is a significant step, signing the contract. However, we are also working with the agency to ensure that the 6 geopolitical regions are well represented. So the success to us will begin to happen when the patient have access to the medicine, and we begin to have a reduction in mortality arising from infectious diseases within the Nigerian airspace. So the benefits is mainly to the patient, and when we begin to record a reduction in mortality, then we're talking about success.
The initiative has been piloted in the 6 geopolitical zones and the FCT. Dr. Agada Amade speaks on the implementation so far.
We rolled it out with the Roche program, and that is an access program for oncology drugs, cancer drugs. And so we've made a lot of progress there. As we speak, patients are already accessing the cancer drugs. The new generation cancer drugs that are very expensive, and before now, patients cannot access it. We have been able to discuss with Roche to take off about 50% of the cost. And so the cost becomes bearable to both the health insurance industry and the enrollees who are doing co-payment.
There are certain procedures in accessing this facility, especially bearing in mind that health insurance is now mandatory?
Generally, under the NHIA or health insurance all over the world, you have to enroll as a health insurance beneficiary before you become a beneficiary. You enroll, then you become a beneficiary. So to access the NHIA cost sharing initiative, you have to have enrolled under the NHIA or the state social health insurance agencies. We're discussing with them for those states that would like to log in. And then the private health insurance, we're also discussing with them. They will have access to this.
Enrollees who have accessed care under the NHIA Cancer Initiative share their experience.
The program has been a fantastic one, I must confess, because if it's to go by the drug they gave to me, the prices, I wouldn't have, maybe by now, I might have not be able to cover up to this 7th one. But because of this very program, it helps me. It deducted a lot of money from me. Now I can now pay some percentage. Yes.
Since the commencement of the NHIA, Roche and Pfizer cost sharing initiative in 2022, over 60 enrollees have accessed care under this intervention in the health insurance platform at the various pilot centers. It is in view of this that the authority recently held a meeting to review the implementation so far and to consider payment modalities to the partners involved in the cost-sharing initiative.
Welcome back from that break. Easy access to healthcare continues in our stakeholders segment. Today in this segment, we bring you an interview with Daramola Babajide Christopher, Coordinator, Oyo State Office. In its operations, the NHIA operates at 3 levels, being the head office, zonal officers, and the state officers. The state officers are the foot soldiers in the authority. Daramola Christopher tells us some of the functions of the NHIA state office.
The state office is the implementer. What we do solely is to implement the policy directives or trust of management in Abuja. At that level, they formulate policies which they cascade down to us and the which we must implement. Besides that, we are also the intermediary between the management and the various people in the state office where we are. We go to them, talk to them about what we do as an office, we sensitize them.
Being an active stakeholder within the health insurance space, Daramola speaks on reforms going on within the NHIA as well as the new NHIA Act.
We have never had this good. It is that Professor Mamadu Nasu Sambo is a game changer, a team player, and the reforms they are brought to NHIA is second to none. They are second to none. And there are so many. If I can read out just a few of them now. You talk of the recently passed NHIA 2022 Act. We have been on it for a very long time, but I don't understand now that materialized. And that's going to be the game changer. Because the former law did not allow for effective participation. They did not make health insurance mandatory.
He stresses further on the impacts of the present leadership of the authority in the health insurance space.
The scheme itself was in the news in the past for various negative reasons. Professor Sambo has been able to come here, calm the frayed nerves, and every strategy that it needs to make use of that this authority, this system works, he has put them in place. And you can see that for some times now, you see people talking about the NHIA, the positive, on the positive note. Of recent, he has been given a number of awards. And I think about a month ago, the SCPC came with the list of MDAs that are deeply involved in corruption.
Daramola had this to say about the recent performance chart that was introduced for the NHIA state officers.
There are parameters used to measure performance. You recall that of recent, there is a major shake-up where management needs, had to remove people from being coordinators and then replacing them with new ones. All is to add value to what the state offices are doing. Now, he has introduced what they call a reward and sanction system. If you do well, you get the reward. And if you perform woefully, the sanctions are also there. Our state office, well, the performance parameters include record keeping, staff engagement, and enrollment figures too are there.
That was Daramola Babajide Christopher, coordinator of the Oyo State Office of the NHIA, speaking on issues that border on the operations of the NHIA state offices. Let us take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: can an enrollee access healthcare services outside his or her state?
We have a list of accredited healthcare facilities all over Nigeria, and you are entitled to, as a referral case, you could be referred from Abuja to access care outside Abuja. You could be referred to any hospital with the adequate skills, manpower, and equipment to treat you in any part of Nigeria. But again, at primary level of care, you are restricted to one facility. And that facility is what we call your primary healthcare provider. So you are registered with healthcare with that particular hospital or health center, and you are to go there to access care at the primary care. That hospital is capable of referring you, like I said earlier, to any other hospital.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
With these, we've come to the end of today's episode of Easy Access to Healthcare for All. Please join us next week, same time and on the same station for another interesting package. Follow us on YouTube and other social media platforms for more on the NHIA. Till I come your way again, enjoy the rest of your evening.